Today I'm going to show you the most helpful essential books for a medical student on a surgical rotation. Before I get started though, I think for all these medical textbooks, especially for your clerkship rotations, the best plan of action in my mind is to find the most current edition and then go back one or two editions and get those books because they'll be a lot less expensive. Instead of paying 60 bucks, you're going to be paying 15 or 20 bucks. You'll be able to buy more books and the information is pretty much the same. The only thing I want to show you is that in case you are planning on going into surgery, there's two textbooks you can choose from, and if you're going to do a lot of reading, you might as well get them while you're still in med school. One is Shorts. It's a pretty standard general surgery textbook. It's a pretty big textbook, but it essentially has everything you need to really get started. The other one you could consider getting is Subistant. It's a nice book as well. I don't really have a strong preference one way or the other. But those are the two main books that people use in my experience. So let's go ahead and get started. The first book you should get for your surgery rotation is the Maxwells Quick Medical Reference. Here's the table of contents on the front here. It's good for most of your rotations. It's got some obstetrical information, a lot of information for internal medicine, and some neurological information and charts like the Glasgow Coma Scale and dermatome maps. One of the things I like to use it for if I'm not sure, if I forgot. It's got reference ranges for common lab values, renal, CBCs, and arterial blood gases. That's pretty helpful. It's also got some sample notes, and it's good for a lot of your rotations. Cost about 10 bucks or so. The next book for surgery rotation is Surgical Recall. The only one I use the recall for is for surgery. I don't know if they have it for other rotations. But essentially it's got a lot of good med student level information, and the way it's set up is they have different chapters for different organ systems like the biliary tract, pancreas, thyroid gland, so it's pretty helpful. And the first couple of chapters go over basic things like the names of surgical instruments and sutures and knot tying, that sort of stuff. The chapters are set up as kind of like a question and answer format, so you could actually go here, read the question, cover up the answer, then kind of scroll down to see if you got it right. So it's nice, easy reading, and it's very good information, especially about things you'll get asked for in the operating room. The next book you should get is the Icu Book by Marino. This is the full book. It's about 1,000 pages. If you're going into medicine or surgery, you should get this book. There's also a new edition that came out, I think, in 2014. If you're not going into either of those specialties, you could just get there's a small booklet. It's about 200 pages. That's something you could read during the rotation, because this is a little bit too long, but it's very good for reference. Next book you should consider getting for surgery and for medicine is the Sanford Guide, Antimicrobial Guide. It's got some information on drugs of choice for different infections and some antibiotic resistance patterns, and also for surgery it has preoperative antibiotic recommendations for different surgical procedures and alternative drugs in case the patient's allergic to the first line. I think it costs about 10 or 15 bucks, so it's definitely worth getting. Next book for any rotation, case files. For surgery, I would read Surgical Recall first, but for any rotation, case files is good. Has about 50 or 60 different cases, and then there's a few questions at the end per case. It's easy reading, and it's nice to quiz yourself and jog your mind. Things like this case files and the pretest series, which is basically just questions, are good because you're jogging your mind instead of kind of perseverating on a chapter out of a larger textbook. I like pretest for every rotation. I don't have the surgery one because surgical recall is a little bit better. But for general rotations, and if you get to it for surgery, pretest is nice too. Last book I recommend, Pocket Medicine. It's kind of, I think they make it for peds and maybe even surgery too, but just having a copy of Pocket Medicine is something you can refer to for surgery as well. It's got the chapters broken down by specialty. I don't really use it that much, but I see a lot of med students carrying it around, and occasionally if I need a quick reference, I will look at it, but I don't really carry it around with me too much. And that's about it.